Hello and welcome. I'm Gwen Taylor, Senior Developmental Editor and Webinar Program Manager at John Wiley & Sons Publishers, and I'm delighted to introduce today's webinar titled Less is More, Using microCT to Assess Bone Loss in Preclinical Models. This webinar is being co-sponsored by PerkinElmer and Current Protocols, a publication of Wiley Publishers. PerkinElmer is a global leader committed to innovating for a healthier world. The company is deeply committed to providing innovative solutions for in vivo research and offers state-of-the-art systems including 2D and 3D optical, PET, and microCT imaging platforms and reagents to help customers gain earlier and more accurate insights into their research. Current Protocols is in its 31st year and is the largest collection of peer-reviewed, authoritative, and regularly updated step-by-step research protocols available for life scientists worldwide. With 18 titles and over 18,000 protocols, Current Protocols is part of Wiley Publishers. During today's program, we encourage you to submit your questions throughout the event by clicking on the Ask a Question box at the bottom of your screen. Your questions will not be seen by any of the other attendees. The webinar will be recorded and available for viewing in the next few days, and we will send you an email with details on how to access the on-demand webinar. So now it is my pleasure to introduce today's speaker. Alexandra DeLille is currently the Director of Technical Applications for In Vivo Imaging at PerkinElmer. She graduated with honors as a veterinarian at the University of Ghent in Belgium, and then proceeded to complete a PhD program in reproductive physiology and molecular biology at Colorado State University, studying angiogenesis and growth factors. For her postdoctoral research, she investigated drug delivery of cancer therapeutics in animal models using imaging technologies at the Cancer Pharmacology Laboratory of the Animal Cancer Center of Colorado State University, in collaboration with the Department of Pharmacology. So let's get started with a very warm welcome to you, Dr. DeLille.
Good morning. I would like to thank you for attending this webinar, and I would like to thank the organizers for the opportunity to present on microCT imaging to assess bone loss in preclinical models. Bone loss is a common medical condition associated with aging, menopause, and smoking, as well as with a wide spectrum of diseases such as chronic inflammation, asthma, celiac disease, diabetes, hyperthyroidism, multiple sclerosis, hemophilia, arthritis, periodontal disease, and various cancers and metastatic disease such as multiple myeloma. It is also observed with certain treatments, in particular with corticosteroids, in which a complex mechanism involves osteoblastic suppression and increased bone resorption. Therefore, there is an urgent need for alternative therapies with minimal side effects to treat and prevent osteoporotic disease. Here you can see a microCT volumetric rendering of the cortical and trabecular structures of the femur of a mouse. Ovariectomized or orchidectomized mice or rats are commonly used animal models of osteoporosis to study bone resorption, inhibition, and bone formation promoting effects. Quantification via microCT of bone mineral density and bone microstructure morphometric parameters offers invaluable data to further our understanding of the effects of novel treatment on disease progression. When reviewing the literature, common microCT bone loss readouts are bone mineral density, bone volume fraction, trabecular thickness, trabecular spacing, and trabecular number. With the desire to develop a relatively inexpensive 3D tomographic in vivo imaging modality, we explored the possibility of fast, low-dose in vivo microCT scanning. When looking at bone loss and trabecular bone in mouse vertebral bodies, we observed that a low-dose scan with slightly less resolution offers equally quantitative results as a high dose, permitting in vivo longitudinal scans. Here we compared quantification of bone volume and tissue mineral density from a 26-second scan with 150 milligray exposure versus the results of a 3-minute scan with a 1+ gray exposure. These samples were courtesy of the Sanger Institute. This was furthermore observed for quantitative bone volume fraction, trabecular spacing, trabecular thickness, and trabecular number measurements. As it is known that radiation exposure affects bone and marrow, as observed and published by Green and Rubin in 2014 and by Gould et al. In 2016, we recommend for in vivo imaging to keep the dose as low as reasonably possible. The Quantum GX microCT scanner features a large dynamic range to accommodate both in vivo longitudinal as well as ex vivo high-resolution scans. The Quantum GX2 features 4 fields of view at 18, 36, 72, and 86 millimeters, each featuring high-speed standard and high-resolution modes. In the table below, you can see the expected radiation exposure for each acquisition setting. This data is peer-reviewed published by Drs. McGank and Liu in Molecular Imaging Biology. Switching gears to biology, here you can see a high-resolution bone microCT image of a control mouse and an ovariectomized mouse 2 weeks post-surgery. We designed an in-house ovariectomized mouse model pilot study as follows. We have 5 mice in both a sham and ovariectomized treatment group, and we imaged by microCT 6 weeks post-surgery. 3D volumetric data was analyzed for ASBMR readouts with AccuCT software. This study was performed by my colleague, Dr. James Singh. AccuCT is a fully automated bone analysis software package that offers robust detection, separation, and morphometric analyses of bone morphometry in 3D microCT volumes. It features standardized microCT bone analysis protocols, calculation of ASBMR morphometry metrics, and calculation of BMD measurements. The software features a drop-down menu in which you may select trabecular, cortical, overall, and Z-axis aligned measurements. Once you click Compute, the Measurements tab displays a table with the ASBMR measurement results. In this slide, you may follow the workflow of the automated AccuCT femur analysis of our pilot study. First, we detect the bones in the 3D volume. Then we separate the bones, and then we separate the bone segments, and then we take the ASBMR measurements. Here is a close-up of the bone compartment segmentation, where the cortical bone segment is displayed in brown, the trabecular bone segment is displayed in green, and the marrow bone segment is displayed in light green. Here's a brief video of the AccuCT workflow. Open an image data file. The image contains both soft tissue and bone. With the first click, the bone structures are identified. Next, the bones are separated and segmented. Next, pick a bone as highlighted in red for quantification. Next, the software automatically quantifies the ASBMR measurements. All done. Here you can see the femurs of both treatment groups segmented and ready for AccuCT ASBMR analyses. One can readily spot erosion in the ovariectomized group. After a complete ASBMR analysis, trabecular total volume, trabecular thickness, and total cross-sectional area were observed to be significantly less for the ovariectomized mice, while the trabecular specific bone surface over bone volume ratio was found elevated. Besides analysis of the femur, we also looked at the vertebrae of the mice. We again used the microCT software to detect the bones in the 3D volume. Then the software separated the bones, then it separated the bone segments, and then it took ASBMR measurements. Once the vertebrae were segmented and ready for microCT, we could visually observe that the vertebrae from the ovariectomized mice appeared broader. However, when measuring bone volume, we could not observe change. At this point in time, microCT ASBMR analyses revealed a significant decrease in trabecular bone volume fraction and a significant increase in trabecular specific bone surface over bone volume. Bone mineral density is a common measurement in bone analyses. One can obtain calibrated BMD measurements using a 5-point hydroxyapatite calibration phantom, which is comprised of varying hydroxyapatite densities housed in a resonance cylinder. A linear attenuation coefficient allows conversion of CT grayscale numbers to BMD. microCT software offers an easy, automated BMD calibration workflow. When the microCT software performs the calibration BMD phantom step, it measures the Hounsfield unit values in each segmented rod and performs a linear regression on the specified densities with the measured values. This produces a calibration curve that subsequently can be applied to animal scans for BMD measurements. The microCT software can perform whole scan BMD and single bone BMD workflows to measure bone mineral density in all bones in the scan or a single selected bone, respectively. Examples from the literature. This slide offers a longitudinal image collation of bone loss in an ovariectomized and control mouse. This was provided by Drs. Miyahara and Arya. In this study by Dr. Kusamori et al., BMD readouts are used to determine bisphosphonate treatment efficacy in an osteoporosis model. In the recent study by Dr. Ten and colleagues, prevention of ovariectomy-induced bone loss by a novel prenoflavonoid is observed in an ovariectomy-induced bone loss model in the rat. You can see pictures of microCT reconstruction of trabecular bone in the distal femur. A marked decrease in bone volume and trabecular number in the vehicle-treated ovariectomized rats, as well as a markedly increased trabecular spacing is observed. A significant decrease in bone mineral density of the ovariectomized vehicle-treated rats is also observed. In the recent study by Dr. Saul et al., published in Bone, the effect of 2 lipoxygenase inhibitors on the vertebrae in ovariectomized rats are studied. 3D scans and 2D slices were evaluated. In figures D, E, G, H, thresholds in green show total tissue, total soft tissue, cortical bone, and trabecular bone. In this study, the 3D assessed parameters evaluated for change are total volume, total BMD, cortical BMD, ventral and dorsal cortical area, tissue volume, trabecular BMD, and total volume. Dr. Liu et al. Published on a vaccine for immunotherapy of osteoporosis. Bone resorption inhibition was measured in immunized ovariectomized rats. 3D images of the proximal tibia slices and trabecular bone structures are featured. Bone mineral density, bone volume over total volume, trabecular spacing, and trabecular pattern factor were quantified. In the recent study by Dr. Yashaki et al., combination therapy in an aged ovariectomized rat model of osteopenia treated with vertebral fusion, bone volume and bone volume over total volume was measured. 3D images revealed that the fusion mass between the transverse processes of L4 and L5 were larger and more developed in the treatment groups. In conclusion, I will summarize how hardware and software advances change the picture of bone analyses and allow for in vivo longitudinal 3D quantitative bone analyses. In a comparison study of microCT software segmentation versus manual segmentation in a bone and joint destruction model in an MIA osteoarthritis mouse study, microCT provided improved accuracy by reducing human error. The yellow arrows indicate areas of incorrect 3D rendering as a result of errors introduced during the manual frame-by-frame segmentation process. The Quantum GX microCT instrument uniquely features subvolume reconstruction. After wide-view scanning, details can be observed by post-reconstruction ROI settings at high resolution without the need to retake another scan. This larger field of view scan offers better flexibility to select a region of interest for image detail. How does it work? Data is acquired at bin 1. Data is downsampled for the first pass reconstruction. Next, you can go back to the original scan sinogram and redo a high-resolution and smaller pixel size reconstruction for a specific ROI. In summary, the Quantum GX microCT instrument features a highest resolution of 2.3 micrometer voxel size, high-speed scans in 3.9 seconds, low-dose imaging for longitudinal in vivo scans, co-registration with in vivo optical imaging, two-phase respiratory and cardiac gating, versatile specimen, mouse, rat, and rabbit imaging, as well as quantitative analyses. With this, I would like to thank you for your attention, and questions are welcome.
All right, thank you, Dr. DeLille. Thank you very much for your presentation. So let's go ahead to the question and answer portion of today's webinar. So if you haven't yet submitted a question, now is the time to do so by clicking on the Ask a Question box at the bottom of your screen. So let's go ahead with the first one. So Dr. DeLille, at what resolution do you recommend acquiring scans for performing ASBMR measurements? Dr. DeLille, do you need to unmute perhaps?
Oh,
so we can
there
hear
we
you?
go.
There
yes,
she is.
that's
All
better.
right.
Okay, so that's actually a very good question. And so as we illustrated during the presentation, there is a drop-down menu where you can select certain acquisition parameters, right? The higher the exposure, the higher the acquisition time, the higher the exposure will be. So it's a fine balance between choosing the optimal setting at minimal dosage where we can still obtain quantitative data. And so it also depends on the species we're imaging. As you can imagine, mice have much smaller bones and require higher resolution scans versus rats, which have larger bones, larger tuberculi, and we can actually get shorter acquisition times to still get enough resolution for quantitative data. And so the best resolution we get with a 4-minute scan, 36 millimeters, but we can easily reduce that to a 2-minute scan, or we can go to the field of view of 72 millimeters to reduce that dosage. So it all depends on how you set up your protocol, and actually our technical support team offers insights. And so when you're getting started with these studies, we can definitely give you feedback. We also have technical brochures that outline our experience with certain acquisition parameters, et cetera, et cetera. I hope that helps.
Okay, sounds great. We're on to the next question now, and that is, how often do you recommend scanning a BMD phantom and recalibrating?
That's a good question as well. Again, it really depends on how you design your protocol and what your study entails. I personally like to take a phantom image each time I have a time point in my study. So let's say I do weekly scans or biweekly scans. Each time I do my scans, I will take a phantom image, and I want to make sure that my phantom image scans are with the same acquisition parameters as the ones I will use for data analysis.
All right, on to the next one. Have you compared results using AccuCT to other methods of analysis?
Yes, we actually have, and that really is the reason why we developed this software, because we wanted to present our customers with an advanced technique where we actually can look at 3D microCT tomographic volumes and generate automated image processing. And the advantage of an automated image processing is that it improves accuracy, consistency, reproducibility, and speed of preclinical osteological research. So then again, as I showed in one of the latter slides, we compared manual segmentation to automated segmentation, and one of the parameters, for example, bone volume, showed higher accuracy, and that was in the arthritis model.
Okay, this next question actually has two parts, so I'll read the whole thing and then come back to the first part. So this person says, I'm a dentist and I research tooth and periodontal bone. And the first question is, can we measure the bone density or volume for the animal model, such as a dog? And number two is, which microCT instrument is best for imaging for the dog tooth study? So back to the first one, can we measure the bone density or volume for an animal model, such as a dog model?
Yes, we could. We have to take into account the limitation of the Quantum GX instrument, where the bore size is about 160 millimeters, and the maximum weight that the arm can hold is about 5 kilograms. So we can actually image specimens, mice, rats, rabbits, guinea pigs, but it would have to be a tiny dog to fit in the instrument. Now, however, when it comes to software analyses, that's a whole different situation. We've actually done rabbit studies where we could segment out the pulp cavity in the tooth, and so data analysis is a whole different setup. At this point in time, AccuCT software is linked to the Quantum GX instrument. So unless we do an ex vivo analysis of the teeth of the dogs, we could scan them in that scanner and then analyze with AccuCT software.
All right. And the second question, I think you've already somewhat answered, but I'll pose it again in case you have more to add. Which microCT instrument is best for imaging in the dog tooth study?
Yes, so if we can do an ex vivo scan of the dog's teeth, then we can use the Quantum GX, but we would not be able to accommodate a full-size dog unless it was a tiny little dog into the Quantum GX. So 5 kilograms is the maximum weight that the instrument can hold, and the diameter of the bore size is 16 centimeters, so it has to be a tiny dog.
Okay. All right, our next question says, when you mentioned doing a longitudinal scan, does this mean that the bones are assessed from anterior to posterior, with the bone being supine or in the prone position?
Oh, that's an interesting interpretation. What we mean with longitudinal imaging is actually imaging at several time points. So you image before you do treatment, and you image 2 weeks later, 4 weeks later, 6 weeks later. So it's longitudinal in time, not longitudinal in the subject. So of course we actually can do z-axis scanning, and the maximum length of that is about 240 millimeters. Okay.
Our next question asks, is there anything in the machine that would allow for sedation of the rodent while the scan is occurring, such as administering a small amount of isoflurane?
Yes, the instrument is fully capable of accommodating live animals, and so we have indeed gas anesthesia built in, and it's a very easy system that easily hooks up. We also can have animal monitoring, such as EKG, etc. So it's fully capable of imaging live animals and monitoring their viability.
All right. Our next question asks, what tissues other than mineral bone are possible to follow by microCT?
That's a very good question. And so traditionally with microCT, we image lung as well as bone, right? Because bone has a very strong absorption and lung does not. But this instrument, since we can do extremely fast scans, and the shortest scan is actually 8 seconds, we can use contrast agents, and these contrast agents can facilitate soft tissue imaging. So that's out of the ordinary from what we're familiar with CT, which is lung and bone scans. Now we can actually do, for example, cardiovascular imaging. We can look at myocardial infarction, and we had an excellent Jove webinar on that subject last year. So if you're interested, please reach out. My email is alexandra.delil@perkinelmer.com, and I will be glad to forward you to the webinar on cardiovascular imaging with contrast agents. We also have a tech note on imaging, for example, liver, spleen, kidneys, etc., with contrast agents and microCT, again, in live animals longitudinally. And then with the lung, of course, we can look at tumors, we can look at fibrosis, etc. There's beautiful applications, and we'll be glad to send you app notes as well as references from the peer-reviewed literature on these applications.
All right, great. Our next question asks, how do you do quality control on the automated segmentation? Do you need to follow up ASBMR segmentation with manual quality control and need to fill or trim in spots?
So actually, when we did our comparison, we have more accurate results with the automated system. Now, however, I can just imagine that when you're used to do manual segmentation with existing software packages, when you transition into an automated system, you probably want to verify that your results are what you expected. And so it's more like a familiarization process where you go through the comparison between your automated and your manual segmentation, and at one point you'll obtain familiarity with the system, and you'll find that you no longer need to compare this to your manual segmentation. So we've done several validation studies. We'll be glad to share you with that to give you the peace of mind that this effectively is a highly effective methodology of analyzing bone parameters. And of course, we love to hear feedback from the field. We're actually working with key opinion leaders in the field to assess the feasibility of this software. And we have great work that we can share with you.
All right, next question is, do you have any experience with blood vessel quantification within bone tissue in rodents with the AccuCT?
Again, very good question. To my knowledge, no, but we have done blood vessel segmentation in cardiovascular studies, so I think we could actually translate that. And the AccuCT software may not be a fit for this purpose, but we can definitely create a protocol with third-party software to facilitate that. And I would take analogy to what work we've done in the past with cardiovascular imaging, as well as, for example, tumor vascularization. So there's definitely a solution.
Okay, next question asks, in regards to other soft tissue scans, has the machine been used in sarcopenia studies and involvement with muscle wasting?
Very interesting. So when we would do soft tissue imaging in muscle, we would really look at the vascularization of tissue. So I don't have a direct answer for that, but we could definitely look with contrast at the perfusion of the muscles. So I think that would be the approach which I would pursue at first instance, but I may have to give this some thought and search the literature and see what would be the best answer to address this particular issue.
All right, we've got some great questions still coming up here. Next one is, what strategy do you use to achieve such high resolution, meaning 2.3 micron voxel size, and keeping radiation dose so low at the same time?
Yes, that's also a very good question, because we have to keep in mind that the Quantum GX is unique in the fact that it has a large dynamic range. Obviously, when we aim for these very high resolutions, we have high exposure to the point where you would not want to expose a live animal to that dosage. So the shorter acquisition times, the very fast acquisition times, are actually allocated to in vivo imaging. When you go to high dose, high res, you really want to resort to ex vivo imaging. And so that's the advantage of this instrument. You don't need to have a separate scanner to do your specimen imaging. So you can do both in vivo, and again, we recommend the lowest dose as feasible, where you can still get quantitative data. So it may not give you the sharpest resolution, but it gives you quantitative data, and you reduce the exposure so you do not affect the biology of the disease. And then, of course, at your endpoint, you can take a high resolution image to confirm your longitudinal imaging over time during the entire study. And so as opposed to just taking high resolution images at the end of the study, it allows you to take multiple time points during the disease process.
Okay, the next question asks, what about cortical bone scans?
So we can do both trabecular as well as cortical, and at many times, especially in bone loss, one focuses on trabecular disease. But if you look at the drop-down menu in the AccuCT, it addresses both cortical as well as trabecular bone.
Okay, we've still got a few more to go here. The next question is, are we able to scan multiple bone samples at the same time with a desired resolution of 8 micrometers?
Yes, we can. So actually, we have the field of view of 36 millimeters, and actually the 72 millimeter field of view allows for a 9 micrometer as the highest resolution, while the 36 millimeter field of view has a 4.5 micrometer highest resolution. So think about it, the 36 millimeter diameter in the field of view, how many bones? So you can almost make like a little hotel with little boxes where you put several bone specimens in, and then you can scan the whole thing. This is something we've been considering doing, but to date we haven't actually done that. But just taking into consideration the diameter of the field of view, you could accommodate several pieces of bone, probably 6 or 8 in one field of view, and just build a holder that holds each of these bones in a little cassette. And that's usually referred to as a little hotel. So yes, that's possible.
Okay, this next question asks, says, I'm an endodontist and I want to measure the dent and bridge quality after pulp capping in rabbits. So is that possible?
Yes, we actually have some papers on dental imaging in rabbits, so I will be glad to share those with you and showcase segmentation, etc., of pulp cavity, etc.
Okay, the next one is, are there other applications then for osteoporosis? Would it still be effective using bone segmentation in cases of deformed bones or new bone growth, for example?
Yes, a very good question. We actually apply the technology to, for example, ectopic bone growth, and we have applied the technology to osteoarthritis. And so, yeah, any bone disease can be, we can look at bone calluses after fracture, for example. So that's all applications we're working on. This particular webinar was focused on bone loss, since it's a field of interest to many researchers to date. But yes, any bone research can benefit from this AccuCT software.
All right, this next question asks, is there a way to differentiate between old bone and new bone formation to be able to monitor bone healing?
That's a very interesting question, and my colleague, Dr. Ali Behros, is actually working on this actively with a group at Purdue University. So we're implementing this and forming algorithms to differentiate both old and new bone, and it's quite amazing the preliminary data we have for that research. And again, please reach out to us, and we'll be glad to discuss.
Okay. Next one asks, what is meant by further segmentation of the bone? Is this separation between cortical and trabecular bone?
So first we actually separate the bones, and then you kind of can manually supervise what the software is doing. And so if you're not completely happy with the segmentation, then you can ask the software to refine the segmentation and do further segmentation. So segmentation is really where we segment individual bones. And as you can imagine, sometimes the space between joints is very tiny, especially in vertebrae, etc. So there you may have to ask the software to do to refine its findings. So there is a step that can allow you to refine. There's also a step that if there was over segmentation, you could control for that. And then the next step is where we actually do the compartment segmentation. And the compartment segmentation is where we separate cortical from trabecular bone from soft tissue.
Okay, next question asks, how do you deal with motion artifacts?
That's a very good question as well. And so motion artifacts are not an issue in the 36 millimeter and 72 millimeter field of view, because there we can actually do gating. If, let's say, for example, you're looking at the heart and you want to look at you want to basically segment the motions of the heart, we apply gating. The same for lung. We can segment inspiratory versus expiratory. Now, when it comes to motion, when you're imaging a bone, that might be an issue if you go for very high resolution in a live animal, and the animal would be moving because, it's breathing and its heart is beating, right? So where that would be an issue would be the 18 millimeter field of view, but obviously the 18 millimeter field of view is not going to accommodate an entire mouse. So then you're basically dealing with an ex vivo specimen which doesn't move, and at that point we don't have motion issues.
All right, so many fantastic questions, but I'm actually going to wrap up the question and answer segment now. And I'd like to let everyone know that today's webinar has been recorded and it will be available for viewing in the next few days. We will send you an email with details on how to access the recorded webinar on demand. So on behalf of today's speaker and our sponsor, PerkinElmer, we sincerely appreciate your attending today's webinar and look forward to your attendance at future events from Wiley Publishers. Thanks.